Okay, this is my persuasion speech. This is my audience, my son, John, and his girlfriend, Megan. Okay. I face you guys. So this is how we go. Today I'm going to talk about the controversy surrounding medicinal marijuana. There was an article in Life Science magazine that states that there's ample evidence to support that there are medical beneficial compounds found in marijuana plants. In 1996, California was the first state to adopt a medical marijuana program. Since then, 23 states, including the District of Columbia and Guam, have adopted comprehensive medical marijuana programs. And 11 other states have also put in restricted programs that allow for low-level THC products. This has led to contradictions in the laws and its classification. Federal laws still class it as a Schedule I substance, which means it has a high potential for dependency and no medical benefits, which still makes it a federal offense to distribute. The state programs that are in place now allow for protection from criminal penalties for marijuana or for medical use. They allow for access to marijuana by the means of dispensaries, caregivers, and for growing it yourself. It allows for a variety of strains, and it also has to stipulate either smoking or vaporization as a method for delivery for the plant materials or the compounds. Problems that we have with the FDA approval over it is that FDA guidelines require careful studies involving very large test groups, usually in the hundreds or thousands, to accurately assess the benefits and risks associated with a potential medication. To date, there hasn't been enough large-scale clinical trials to show that the benefits outweigh the risk of the entire plant. But there has been successful research on specific compounds, and that is the cannabinoid compounds, THC and CBD. They actually there's two medications that's been approved, FDA approved in the U.S. that they have these two compounds. The first one is Marinol, and the other one is Sesamat, and they both are used to treat nausea in chemo patients and help with the wasting disease of AIDS. A third medication, Sativix, is used in the UK and in Europe to treat the spastic movements associated with MS, and it's in the third phase of trials in the U.S. to establish its effectiveness and safety in treating cancer pain. The pros and cons that are listed with marijuana use for medical reasons is that the Institute of Medicine states that their potential therapeutic values of cannabinoid drugs, primarily THC for pain relief, control of nausea and vomiting, and appetite stimulation. It also notes that the psychological effects, such as anxiety reduction, sedation, and euphoria, can influence and enhance their therapeutic value. Recent studies have also found that it's been effective in relieving some of the symptoms associated with HIV and AIDS, cancer, glaucoma, and MS. The Institute of Medicine also warns that although smoked marijuana is a crude THC delivery system, that it also delivers harmful substances. The known health risks that are associated from the Life Science magazine is impairment of short-term memory, altered judgment and decision-making, reduced fine motor skills and coordination, slowed reaction times, in rare extreme cases, it can cause extreme paranoia or psychosis. There is no evidence to support that smoking marijuana causes lung cancer in any way, but it can aggravate certain issues like bronchitis or give you chronic cough. According to the CDC, there is no record of anybody dying as a direct cause of marijuana being its sole contributing factor. Nobody has died. They report every year. There's never been one. When you compare that with alcohol and prescription medications, the health risks involved with alcohol use include liver disease, neurological problems, psychiatric issues, increased risk of certain cancers, alcohol poisoning, and according to the CDC, about 88,000 Americans die each year due to excessive alcohol use. Half of those are due to chronic use. The other half are from acute situations like drunk driving and alcohol poisoning. And an average of 1,600 of those people are due to alcohol poisoning a year. Health risks of prescription drugs, according to the National Institute on Drug Abuse, is the first to know that the commonly abused prescription drugs include depressants, opiates and morphine derivatives, and stimulants. The health issues with them include respiratory distress, extreme low or high blood pressure, unconsciousness or coma, insomnia, seizures, heart attack or stroke, and death. According to the CDC, around 41,000 deaths occur each year from drug overdose. Of them, 22,000 are due to prescription drugs abuse. The rest are for illegal medications or narcotics. The rates of abuse is that according to the National Institute on Alcohol Abuse, alcohol is the most commonly used addictive substance in the U.S. 1 in 15 adults, which is approximately 17.6 million people, suffer from alcohol abuse. More than 15 million people abuse prescription drugs each year, which is more than cocaine, hallucinogens, inhalants, and heroin combined. Marijuana is the most commonly used illicit drug, and in 2012, a survey conducted by the Substance Abuse and Mental Health Services stated that an estimated 14 million people admit to smoking marijuana at least once last year, and that of that 7.6 million people report using it on a daily basis or almost daily basis. There are obviously risks associated with the use of marijuana, but there's also a risk associated with alcohol and prescription drugs use. At least marijuana and prescription drugs have shown to have valid therapeutic values. According to the Institute of Medicine, there's absolutely no known medical value for consuming alcohol. I don't expect this information for people who are totally against marijuana. That's not going to change it. But it is going to allow people to realize that the controversies need to be changed. There's obviously apparent that marijuana has potential medical uses. And it poses no more of a risk than alcohol or prescription drugs to an adult. There needs to be a unilateral legislation regarding this issue, so they need to take where this federally, they need to put that into effect. In 2009, the Attorney General sent a memo out and encouraged federal prosecutors not to prosecute anybody for the selling or using of medicinal marijuana. And also in 2013, the Justice Department stated that they were not going to challenge the state programs and legislation as long as they have strict-based guidelines governing them that keep with the federal ideas and stipulations. And they reserve the right to challenge some states if they see necessary. And so that's it. Yay.